So what you have here are the contents of the bandage kits that we send home in our equine bandage kit. So the first thing you'll have is your non-stick dressing. You also will get a pack of gauze sponges, a small roll of gauze, a sheet cotton, a brown gauze, a vet wrap, and an elasticon. So when you go to apply your bandage, you want to try to avoid touching the bandage material as much as you can, so opening it cleanly. The first areas or layers of the bandage that you'll need will be your non-stick bandage that'll go directly against the wound or the sutures, the 4x4s to go behind that, and the roll gauze. So using just a corner, you can lift the sterile gauze and place it on your gauze pad, but again, try not to touch the middle where it's going to be against the horse's skin. This can then be taken gently out of the tray by the corner again to avoid touching the center. So for a distal limb bandage, for example, after a splint bone surgery or if your horse has a wound on their cannon bone, we'll start with the non-stick gauze or adaptic, followed by a stack of sterile 4x4s, and this will be held on with your cling gauze. This should be wrapped over the leg snugly enough to hold the gauze in place, but not very tightly. And this can be taken a little above and a little below the wound to just secure this gauze in place. When you reach the end of your roll, you can tuck the end in order to hold it in place while you get ready for the next layer of your bandage. So once your roll gauze part is on, the next step will be the sheet cotton. This will come in this blue outer casing to keep the sheet cotton sterile. As you open it again, you want to not touch it excessively, although it's okay to touch it to some extent as you're going. So the sheet cotton will be held in place with the brown gauze. That comes in this paper tube. You can pull that out, and then you'll take your sheet cotton to apply to the limb. The next layer of your bandage is going to be the sheet cotton. This should be placed with your wound centered under it. In the same area you would put a standing wrap. And this should be wrapped with nice even pressure and fairly snugly around the horse's limb. The sheet cotton is held in place with the brown gauze. The brown gauze should be placed in with firm pressure and with about 50% overlap between each layer. Make sure to leave a small portion of the sheet cotton from the top and the bottom of the limb. Again, once you've reached the bottom, you again want to have that little piece of sheet cotton sticking out with no brown gauze contacting the skin. Once you've reached the bottom, just work your way back up, again with 50% overlap with each layer. And as always, make sure you're wrapping in the same direction with each layer of your wrap. Again, with this, you can tuck the tail in to hold it in place while you get ready to apply your next layer. The next layer for this bandage is the vet wrap. And this should be applied directly over the brown gauze with firm, even pressure. The vet wrap is inherently a little wrinkly, so you want to stretch it so that's a little more taut as you go. Again, with this, you want about 50% overlap with each layer of the vet wrap. When you reach the bottom of the bandage, make sure to leave that little piece of sheet cotton out at the bottom as well. The last layer of your bandage is the elasticon. This is an elastic and adhesive bandage that we apply to ensure no dirt or shavings gets down into your bandage. About half of the elasticon should be on the bandage and half on the horse's skin. You want to wrap this loosely so that it's not overly tight on their skin. With the elasticon, go once or twice around the bandage, and then you can cut the elasticon. With the elasticon, elastic on, it may help to pre-stretch it in order to prevent getting it on too tightly. At the bottom, you'll repeat the same thing with part of the elasticon on the bandage and part of it on the horse's skin. And again, you want to take this around once or twice before cutting it off. Now your bandage is complete.